Last year, there were almost 53,000 live births in Bungoma County. 53,000 live births in Bungoma County. Ametoka kuniambia leo Ken, na mko wengi, hii Bungoma mko wengi sana. Ni ukweli. We are giving birth to over 50,000 babies every year. Then it means we have to increase our funding and our resource to health equitably so that we're able to meet the expectations of 50,000 new people in this county. And my question is it sustainable? Is it? So, tukisema kwamba women and children are suffering. They are dying from needless deaths that could be avoided. The first way to avoid those needless deaths is family planning. Watoto kama kuku. Kuku inazaa watoto wengi, wengine watakufa, wengine wabaki. Si ndio? Sisi tumetoka huko. A man of my age, if you have more than 5 children or 4 children, umeanza kuenda vibaya. Si ndio? Lusana, I'm sorry, if you have 15, because one thing that any country can do to see growth, economical growth, is population control. Do you agree? China did it. India thought, now India has bypassed China. Already as a county, we have tried to increase accessibility to healthcare services. We have opened up 33 new dispensaries to offer care to our people within 1 year. We have moved from 114 dispensaries to 147 dispensaries within 1 year. So that no mother can go beyond 5 kilometers without reaching a health facility. 2, we have ensured that the focal point for treatment of our mothers and children should be the health center. That every health center should have a maternity, should have services that are able to ensure that a baby and a mother survives. And we have improved the number of health centers in Bungoma from 15 to 53 within 1 year. So, our work is to ensure that we cut out the second delay. I don't want to mention about referral. When you see ambulances making noises all over, something is wrong. Something is wrong. Because patients need help. They don't require health care. Our services is what constitutes healthcare, but the patients we serve need health, and therefore they should get this help at the nearest facility that's close to their dwelling. So when you transfer them from where they live to another site, it means there's a failure in the healthcare system. I don't say we can cut out ambulance services, but what are we referring? Maybe we should refer accidents, but not refer mothers. Because for mothers, they go through what's called IBP, Individual Birth Plan. If we assess them well, no mother will deliver as an emergency. All deliveries will be planned, and therefore will not have need to refer a mother from point A to point B that is an emergency case. And that's what we are trying to do to ensure that all our facilities are appropriate enough to be able to give quality services to our mothers. And we want to leverage on the digital space. This time round, we have given CHPs smartphones so that they can give us accurate data on what's happening in the household. So you have heard about what has been done for the blood transfusion services in Bungoma. And for me, being here, amount of the testimonies of what you've done in planning with the team in evidence for action. So for me, and say, for the short time that we have been with this organization, we have seen enormous and tremendous developments within our healthcare system, and want to hope that the skills and the knowledge that they have impacted among the healthcare staff is going to last long, and to ensure that we're able to carry on even with or without more partner support. So no question. India today, there's issues of sanitation. There's garbage. Kama iduol kare jitu tunapata usiku moja umejaza hapo takataka. In the morning you have to have graders na toa takataka ndo gari zianze kupita. So if we don't control our population, we put pressure on the existing resources. Bungoma County, we have moved from fertility rate of 5.1 to 3.6. Yani, the average number of children a woman of relative age can have has moved from 5.1 to 3.6. So wanaume msifanya mama waongeze population tena, sawa? We need to, lakini msifikie Murang'a. Unajua, I was in a meeting last week in the Council of Governors. As much as we are advocating for things with maternal and child health, my counterpart from Murang'a was looking at me in dismay.
And I'm often, every time I come here, I leave really challenged, but also encouraged that the partnership that an organization like ourselves can have with a county government, that is really a partnership, right? Goes beyond the money. I think everything that has been mentioned here today, it's about partnership, it's about relationships, right? It's about working together, holding each other's hands and actually supporting each other. So I just want to tell you that as much as we're having a closeout, I'd rather call it a celebration of where we've been, right? And so the question is, where do we go next? And a lot of the learning that we're taking here, we want to take it forward. We want to speak to our different clients and look at different ways of working. And not the national government, actually even the county government, there's a whole discussion around digitization of health. Now these are areas that we're really looking at, issues of climate and health. I'm sure you're grappling with those same issues in terms of the impact that climate change has had on health. Those are areas that we're really building into. And so we'll always have Bungoma in our hearts, in our minds, as we go to programming for new work.